Good morning, everyone. Here is an introduction to pain, sleep, and comfort during care of older adults. And as you know, this is a very important topic. So, sleep is one of the major concerns in older adults. Why is that? Because it's a factor that affects health and well-being. So, if there is no adequate sleep, there will be a lot of health concerns such as stressors, such as stress or physical stress to the body, for example, increased production of insulin and glucose at the same time. So older adults, they fall asleep early in the evening and wake up early in the morning, and this is a very big issue in this population. Also, their non-rapid eye movement or the non-REM sleep decline in the time spent, which is in stage 3 and stage 4 of deep sleep. There is also a reduction in rapid eye movement. And as you know, we need these deep sleep stages so that we can process memory and rejuvenate our body for the next day. But they don't have that privilege. There is also changes in amount of time spent in each phase in general, and they are easily awakened. The common sleep disorders and causes are, for example, insomnia, as you know, nocturnal myoclonus, so there is contractions in their muscles during sleep. There is restless leg syndrome, and a group of you, I think, are doing restless leg syndrome, which is very interesting. At night they cannot rest because of tremors or a lot of contractions in their legs, especially. And also sleep apnea, which can happen because of heart failure, because of for example, congestion or respiratory congestions. There are other causes that can be caused, or insomnia that can be caused by drugs, such as steroids. So to promote sleep, we need to manage the cause. For example, if they are suffering from pain, we need to reduce pain, and we need to manage pain by medications or by herbs, and also reduction of stress in addition to activity rest schedule. So we give them an activity and then rest for, like, for example, half an hour or an hour. So there is a certain schedule and it's personalized for each patient. Next is the comfort and pain management. It's also a very important issue because with age, there is an increase in discomfort in general, and also pain is the greatest threat to comfort. So 75% of our older adults, they experience weekly pain, mostly because of chronic pain. However, there are types of pain that we need to know. For example, the first one is nociceptive pain, which affect bones, soft tissue, and masses, and it's usually localized and throbbing and aching. The other type is neuropathic pain, which is usually sharp and stabbing and high in intensity. The other type is also somatic pain, which can be chronic or acute. And of course, you know that chronic, it means that it can stay for more than 3 months. So patients with cognitive impairments may come to the hospital with a lot of manifestations that can tell you that they are going on under a lot of pain and discomfort. For example, they will be agitated, they will have a decrease in their socialization, they will be crying and moaning, their vital signs are going higher, and they're perspiring. And for example, if they are walking, there is an increased pacing and wandering. They also may manifest aggressive behaviors such as hitting and banging objects. So we need to manage pain and discomfort with so many strategies that we can use for healing and for managing pain. For this introduction, I will talk a little bit about medications for pain management. So we always like to start low and go slow, which means that we will start with the lowest dose and go slowly by increasing the doses. Because as you know, and we talked about this in the last class, that there are adverse reactions that can happen very easily in the older adult population. There is a common myth among older adults that I want to present to you, which is that they are always afraid of being addicted to medications. So we need to be careful when we are prescribing medication to this population, and explain to them that there is no harm and it may not cause addiction, or we can treat addiction in certain ways. However, there are certain considerations that we need to consider when using them in older adults, such as, for example, we need to consider if they are contraindicated with older adults. If there is, we need to observe any responses to these medications. Also, to schedule pain medications at different times, so there is a regular management of medication and a regular evaluation of their responses. I want you to review the pain assessment tools from the book. These are very important, and you may have seen some of them in the hospital, but please go through them. We have many of them in the book, and I also mentioned them in my lecture. Thank you so much for listening.